comes a time when we hear a silent call.
Today marked a pivotal moment for the continent as leaders, researchers, innovators, development partners and the frontline health professionals convey to shape Africa's health and development future at the inaugural Africa Health Summit.
When the world must come together as one, there are people dying.
While delivering his speech, the Speaker Osiante of Kenya, Right Honorable Amson King, noted that Africa is still grappling with persistent health challenges that continue to push many people into poverty. He reflected on the COVID-19 pandemic as a stark reminder of how deeply health crisis can disrupt lives and livelihoods across the continent.
While too many households still face catastrophic health expenditures that push families into poverty, access to essential health services remains uneven and often insufficient. These are not abstract data points. They represent real lives. Families delayed from care, communities underserved, and health systems stretched beyond capacity. The COVID-19 pandemic further exposed global inequalities, where supply constraints left Africa wanting, even as others secured surplus. The moment reminded us that health insecurity is not just a development issue, it is a sovereign issue.
He further emphasized that African nations must strengthen resilience within their health systems by investing in local innovation, embracing shared accountability, and ensuring inclusive and sustainable financing to better safeguard the continent against future health crises.
It shows that universal health coverage in Africa is achievable, not in theory, but in practice. This approach echoes the Africa Health Strategy call to expand social protection, address the social determinants of health, and invest in equity, ensuring that development and health progress move hand in hand.
The Director of Program Management at the World Health Organization reaffirmed their commitment to building sovereign and sustainable health systems across Africa.
We know the stakes. Millions of households still face catastrophic out-of-pocket costs when they seek care. Financing remains inadequate. Most countries spend less than 5% of GDP on health.
The Deputy Speaker of Parliament, Honorable Thomas Tiyeba, revealed that a 52 million medical manufacturing facility had been launched to produce tuberculosis vaccines, following the direct support from the President Museveni to Quality Medical Industries Limited founders.
Cost them, engage with God parliaments, the ministers will bring them to parliaments, and we see how we support this very, very important aspect. I'm a very happy African today. Very, very, very happy African today to see that critical players from Africa are here. Not only to look at solutions, but you need to come up with a clear resolution that you are going to support African manufacturers.
Health champions have engaged in meaningful discussions on building stronger and more sustainable health systems across Africa with a focus on innovation, local solutions, and equitable access to quality care.
And indeed, one of the reasons the Africa CDC's birth was escalated was because of the Ebola 2014 outbreak that hit West Africa.
On the continent, Africans don't know what sort of infrastructure exists on the continent. There have been millions of dollars of investment from PEPFAR to do research.